A visitor to one of these modern cities discovers all kinds of people on the go. Among them, you might find one living link with the glory of the past.
I beg your pardon, sir. Could you direct me to the Polyclinic Hospital?
Polyclinic?
Yes.
Yes. It's right down the street, Mac.
Oh, yes, I see. Thank you very much, sir. But my name is not Mac. I'm called Galen. Galen of Pergamum.
Pergamum?
Yes.
Galen, Pergamum? It's a nice name. I bet your mother was real proud of it.
Oh, she was, yes, indeed. But, of course, that was almost 2,000 years ago.
2,000 years ago?
Wait here.
Are you all right? That was a crazy thing to do.
So I see. But what about the boy? Was he harmed?
I guess not. He's gone already. But what about you? I better get you a doctor.
That won't be necessary. You've already got one.
You were a doctor? Oh, how fortunate I am.
Yes. This is your lucky day, Mr. Pergamum.
You know this man?
Well, his name is Galen Pergamum, but between you and me, he may be some kind of a nut. He told me he was 2,000 years old, and that was before the accident.
Well, he bumped his cheekbone, but other than that, he seems to be all right. How do you feel?
Most grateful. Not only for your prompt attention, but for your obvious concern as well. Dr.
Reynolds. Jim Reynolds. You think you can get up?
Well, I've been doing precisely that every morning of my life. And that's for several more years than you have.
Now, let's see if we can make it over there to the pharmacy.
Pharmacy? Well, this is my lucky day. As a matter of
And
fact,
I'd like for you to meet my fiancée,
Oh.
Ruth. This is Galen Pergamum.
Are you all right, Mr. Pergamum?
Well, I think so. But please, to my friends, I'm Galen.
You can sit here.
Oh, thank you. Amazing. The quantity and the variety. So much more than just simple herbs and medicaments.
But we're here to get just one of them, for that bump of yours.
Oh, doctor, it's only a slight abrasion and contusion of the inferior edge of the zygomatous arch.
Galen, suppose you let me make the diagnosis and prescribe the proper medication. That is the duty of the attending physician, isn't it?
Yes, indeed.
And I'll need your home address. I assume that'll be in Rome.
Rome?
I'll be right back.
How did he know you were from Rome?
Haven't an earthly idea.
Well, have you come to town to stay? Or are you just passing through?
Passing through is the perfect expression. I'm on my way to Ithaca.
Oh, the university. Then you're a teacher.
On this occasion, I go seeking knowledge.
Don't tell me you're a student.
Are not we all?
Hi, Jim. What can we do for you today?
Give me some cotton, Cliff, and a little hydrogen peroxide.
Somebody hurt?
The old gentleman over there with Ruth.
In the toga? Where'd you pick him up?
Literally out of the gutter. Some kid on a bicycle sideswiped him.
Hurt bad?
Just shook up a bit. But you can't take any chances.
Oh.
What a beautiful medallion.
Oh, thank you.
May I see it?
Of course.
What does it say?
It says, physician to the Emperor, Marcus Aurelius.
Galen, you seem to know a great deal about medicine.
At one point in time, I thought I did. But as a colleague of mine said, life is short and the art of medicine is long.
What a wonderful way to put it. Who said that?
Hippocrates. He meant that medicine is a never-ending quest for knowledge and the truth.
Thank you. Bye.
This is Cliff Johnson, the pharmacist.
Oh, yes.
Glad to know you. It's always a pleasure to meet a new customer.
Well, the pleasure is entirely mine, Mr. Johnson. You see, I'm attempting to update my knowledge of modern medicine. And since you're the prefect here, I'd like in Roman terms to interview you.
Well, sure. As soon as Jim gets you patched up.
I'm almost done, Cliff.
Thank you.
Now, I want you to take one of these if you feel at all uneasy.
Very well. Well, this is a sedative, Doctor. Why?
For two reasons, my friend. First, you may have suffered a slight degree of shock. Second, if you did, that medicine will help you.
Two very good reasons, Doctor. Prevention and treatment, I understand.
I'm glad you do. But just in case, I'd like to see you again at 4 at the hospital. It's right
Down
down...
the street, I know.
And that's where I should have been a half an hour ago. Thank you, Cliff. See you later. And you too, Galen.
I'll be there.
Bye, Galen. Cliff,
Bye.
see you later. What do you think, Jim?
About what?
About him, Galen. He seems like such an unusual man.
He certainly does. Takes all kinds. And that wardrobe, right out of Ben-Hur. I don't know whether he's playing a part or what his game is.
What do you mean?
Well, to begin with, he's using the name of one of the famous men of medicine. There actually was a Galen of Pergamum, a great doctor who wrote over 300 books about medicine. But that Galen lived back in the days of the Roman Empire.
Oh?
But he must have been quite a guy. Worked his way right to the top. Physician to the Emperor.
Marcus Aurelius.
That's right. How did you know?
Oh, I read it somewhere.
Thank you.
Bill, will you take over for a while?
Glad.
Now, sir, you wanted to ask a few questions. Where shall we start?
Oh, with any of these modern healing remedies, where does one begin? You have hundreds and hundreds of them.
That's right. Some are classified as botanicals.
From plants and roots.
Some we call biologicals.
From living organisms.
Right. Some are natural chemicals.
Extracted from plants and animals.
Why, yes. And some of the newest ones are synthetics.
Oh, yes. Produced from chemicals by altering their molecular structure.
Exactly, Galen. Exactly.
Tell me, Mr. Johnson, are the medicines that are still referred to as Galenicals?
Why, yes, as a matter of fact. That's because a lot of them were discovered by an old Roman physician.
Oh?
Well, I really don't know how old he was, but he did live a long time ago. That is, if you consider 2,000 years a long time.
Oh, I do, Mr. Johnson. Indeed, I do. These look familiar.
Oh, yes. They were my father's. He was a pharmacist, too.
And when was that?
Right after World War I. The roaring 20s. Flappers and Prohibition. Calvin Coolidge and raccoon coats. 20s were exciting years. In Hollywood, there was Doug Fairbanks and Mary Pickford and the Sheik, Rudolph Valentino. In sports, there was Babe Ruth and Bobby Jones and Red Grange. Lindbergh had soloed to Paris, and they welcomed him home wildly. The 20s were exciting years in the world of medicine, too. Until then, very few medicines cured or prevented disease. In spite of the claims, some were actually good for nothing. The old quarantine was to stop contagious diseases, but people still died in droves. Even a ruptured appendix was usually fatal, and diabetes often a death sentence. Then came the big breakthrough, insulin. With a simple injection, the diabetic was given a new lease on life. In the 1930s, things really started to happen. Pharmaceutical companies improved the medicines we had and searched for new ones. Sulfanilamide, the first of the amazing sulfa drugs. Then, in 1944, penicillin. Thousands of American soldiers were saved because of it, and it has practically ended the threat of another major killer, lobar pneumonia.
"1944. To me, that's just yesterday."
Penicillin was the beginning of the age of antibiotics. Come to think of it, of all the prescription drugs I dispensed, most of them were unknown 10 years ago.
Remarkable.
Yes, what seemed like a miracle just a short time ago is now taken for granted, especially with some of the younger people. And that's understandable.
Indeed?
Sure. Because words like diphtheria, scarlet fever, and polio are mostly in textbooks now. But we older folks remember when they spelled terror.
Oh, Mr. Johnson.
Hello, Mrs. Wilson. How are you today? And how's the little boy getting along?
Johnny's just fine, Mr. Johnson. And the doctor says he can go back to school in the fall.
Isn't that just great? I'm so glad to hear it.
Oh, you can imagine how I feel because I remember so well. Doctor, tell me the truth, please.
Well, now, Mrs. Wilson, this was a few years ago. Things might be different. But if our diagnosis of the infection is correct, there's a new antibiotic which is proving successful in cases like this.
Oh, please, God, let it work for Johnny.
Well, we've already started the injections, and when he goes home, he can take it orally.
He won't ever come home again. Well, that's what I thought, Cliff, but now he's home and he's fine, and I'll never be able to tell you how grateful I am.
You know, that's what makes it all worthwhile, when everything turns out the way it's supposed to. I never thought they'd pull that kid through either.
I'm most curious about that particular medicine, Mr. Johnson. Now, when the diagnosis
Hello, Mr. Clark.
was made...
Charlie.
Cliff?
I didn't know you were here. How long you been sitting out here?
Oh, just for a few minutes. Well, I could see you were busy.
Oh, Charlie, I'd like you to meet Mr.
Galen.
Oh, Galen. Galen, this is Charlie Clark.
How do you do?
Howdy.
Galen's writing a book or something. Now, this is the man you want to talk to about that medicine. Charlie is the professional service representative for the company that made it. Now, why don't you interview him for a while, huh? I have some work to do.
Well, that's an extremely impressive title, but just what does a professional service representative do, Mr. Clark?
Oh, sit down. Our number one job is to supply knowledge about the products our company manufactures. And, of course, we make sure they're always available.
Knowledge is indeed important.
Vital. Particularly in the case of new medicines. You see, All physicians are informed as to the exact ingredients and therapeutic value of each drug. And so are all pharmacists.
Education, yes. And you see to it that this knowledge is made available to every physician and pharmacist?
Yes, and dentists, too.
My, you must be a very busy man.
Oh, I cover only a very small number of them.
Then there are many men like you.
Yes, and there are many medicines.
I understand. Thousands.
There certainly are. Look here. Cliff. Here, pad, will you please? Thank you. They can be classified in one of three broad ways: by a chemical name, a generic name, and a brand name. Now, the chemical formula might look like this.
That would be prednisone.
Oh, yes. As a matter of fact, it would. But it's still not a medicine ready for use by the patient until processed with other ingredients to make a finished product. That's where the mortar and pestle used to come in.
Used to?
Oh, yes. Today, when a doctor writes a prescription, he'll specify one of these. A product he knows by its source and by the reputation of its maker.
But why should a physician prefer one of those?
Because he can be sure that each one is a precise formulation, manufactured to exact specifications, and already compounded into a wide range of dosage forms. Nothing to guess at.
Ergo, in the complex fight against disease, the physician of today has a great choice of weapons of healing.
And that's the way it should be, because he knows the condition of the patient and which medicines will be most effective. So for your own safety, you can't buy them without a prescription. That's the law.
The law?
Oh, yes. Manufacturers are answerable not only to the patient and the physician, but to the government as well.
Res publica regulus constituit.
Hmm?
A Roman saying the government sets the standards.
Oh, well, officially you could say that, but in actual fact, the government, the industry, and the profession work together to establish standards of safety and effectiveness. Of course, reputable manufacturers usually exceed those standards by applying rigid quality controls.
Quality controls? When are these controls exercised?
Before, during, and after making the product.
You see, there may be 20 different elements in a single product. Because of all these elements, one drug alone might undergo as many as 1,000 separate quality checks. The people who carry out this work are highly skilled and thoroughly trained. They use the most sophisticated scientific equipment you can imagine. Our equipment makes for precision, and all our people recognize the importance of reliability in this business.
Ipso facto, quality controls equal quality drugs. An interesting equation.
That's very good, Galen. Good. Of course, the physician and the pharmacist are aware of this. And being men of science, they know where it all starts, too.
And where's that?
In research and development.
In laboratories across the country, research scientists work to improve today's medicine and find remedies for diseases that are still unconquered. The gathering of data, formulation of experiments, testing of ideas can be endlessly drawn out. Often there are detours before the right path is found, discovering what won't work as well as what will. You often hear the term wonder drugs. Well, pharmaceuticals are wonderful when they save a human life or fight a dread disease. Their discovery and development is pretty wonderful too, because it's the result of tireless efforts and adherence to the highest standards of science. A lot of dedicated people trying to solve old problems with new answers.
The quest for knowledge makes all men brothers.
Yes, but it's a big risk against great odds, because for every new drug, test tube to market, thousands of compounds may have been tried and discarded, and may have taken as long as 15 years to develop at a cost of millions of dollars.
Such figures stagger the imagination.
And even when a drug is produced and in demand, a new discovery can make it obsolete overnight. Of course, that's the kind of competition from which everyone benefits.
I see a theme through the grand sweep of history, uniting the past and the present.
A theme?
A reverence for life and the inquiring spirit to search out the means to sustain it. What could be a nobler engagement? And you both play a part in it.
Charlie, it's still a long way from the laboratory to here.
You see, we must submit documented evidence and in detail to the Food and Drug Administration in Washington before any new product is made available.
Magnus Olympus, what an involved and costly endeavor this all must be.
Yes, it is. In research, development, and testing alone, pharmaceutical companies have spent billions of dollars. Now, those aren't government dollars. They come from private industry. And that doesn't include research done by hospitals and universities and the government itself.
But just one new discovery can mean a lot to a sick man with a family to support. Less time in the hospital and back on the job much sooner than a few years ago.
But this man has to pay for these modern medicaments.
True, but their cost is small compared to his lost earnings. As you know, the cost of food and most other items is up.
It might surprise you to learn that prescription prices haven't changed that much. Pharmacy. Why, yes, he's right here. It's for you, Galen.
A call for me? Now, who in the world? I'm Galen. Yes, Dr. Reynolds. Well, you said 4 o'clock. Oh, my goodness. I shall proceed at once.
Have you had any pain this afternoon, particularly here?
No, but I must say my head is full of facts, Doctor. The art of healing's come so far. You've learned so much in such a short space of time. It's almost a miracle.
We have so much more to learn.
What have you learned about me?
Apparently very little, except that you don't seem to have anything wrong with you, physically. Have you been in a hospital lately?
Other than this one, no. Why do you ask?
Then what's the reason? Do you really believe that you're Galen of Pergamum?
Then you do know him, his work.
Of course.
But you don't think I'm he?
Impossible. He lived 2,000 years ago.
1,800 years to be exact, Doctor.
Well, let's not quibble about a couple of centuries. I give up. Whoever you are, mister, you're a strange cat.
Perhaps I am. But remember, Doctor, they said that cats have 9 lives.
Galen? Jim!
Hi, honey. You're a little early, aren't you?
Yes, I just rushed over from the library. I was hoping Galen would still be here.
He is.
Oh, good. There's something I want to show you.
Yes, in just a minute.
Yeah, but you ought to see it now.
Just as soon as we say goodbye to Galen.
But Goodbye, Galen? But you're not leaving.
I must. As the doctor knows, our days on Earth are limited. There's so much to do and so little time to do it in that even if a man had 1,800 years, it'd be, in his word, impossible. But I learned one thing today. There's some things we think are impossible that can be realized. Because dedicated people have faith and the freedom to pursue the unknown for the good of all mankind. I have great faith in you, Doctor. Have a little in me. I'd be honored if you'd accept this humble memento of my visit. A small token of gratitude from Galen.
Well, I'll be. It's a Roman coin.
Well, of course it is. What else is there? My friends, farewell.
Galen! I just wanted to say goodbye. And good luck, Doctor, wherever you're going.